Hi everybody, I'm Dr. Andrea Orvieto from SOFLA Acupuncture and Wellness. And today's topic is quite interesting. It's not one that's spoken very openly about because we don't like to talk about things like this. But it's really important, especially if conceiving is in your wishes. And I'm talking about understanding what your body is trying to tell you during your cycle, and more specifically, what your cervical mucus or cervical discharge is trying to tell you. Because your body can tell you a ton without having to use ovulation kits, thermometers, or any of those gadgets out there. Your body is the best indication of when you are most fertile. So let's chat a little bit about this cervical mucus and what it looks like. But before we do, let's refresh. Our cycle starts on day 1 of our bleed and ends on day 1 of our next bleed. It's important to understand how many days that is in between that so we have a better idea of, are we having a healthy cycle overall? And ideally we want to see that at about 28 days. Not all women have a 28-day cycle, and that's okay. Some people have a couple days less, some people have a couple days more. It's just important to see what your body's trying to tell you through that cycle, because you still can be ovulating. So let's talk about your cervical discharge. Day 1 you bleed, and after you bleed about an average for 5 days. And after that, you don't really have much discharge immediately following your period. Once your estrogen levels start to rise, your body starts to work and you start to have more cervical mucus, okay? So in the beginning, it's going to be slippery, rubbery, and that's just an indication that your estrogen is rising. And then right after that, you have a discharge that is more like hand lotion consistency, a little bit thicker, a little bit more cloudy. And that's telling you that your fertile window is right around the corner, because then comes your most fertile mucus. Right after that hand lotion type, you will have something that looks more like egg white. It's sticky, it's stretchy, it's clear. Some women have a little bit more watery. At the start of when that happens, that is the beginning of your most fertile window. At the end is when ovulation is about to happen. So your fertile window is very short, and it's important for you to be able to track that so you have an idea of when your most optimal time to conceive is during your cycle. So if you have not started tracking that yet and you have not been successful in conceiving, this is a really great time for you to take note. Go to the bathroom when you wipe, look at what it looks like, have an idea of how many days you have this cervical mucus. It's important to understand. Some people may have 2 days, some people may have 3 days. Your body is different, and it's important for you to know more information you know about your body, especially specific signs that your body is giving you, the better chance you have to conceive successfully. So if you have any questions about what your cycle should look like, or anything about your cervical mucus, maybe you're not getting, maybe you don't have this egg white consistency, that's something that we should discuss and to give you a better opportunity to conceive. So if you have any questions, please reach out, and I look forward to seeing you in the clinic. Have a wonderful day.